Yes, sir. Hello, I welcome everyone to all of you in Keynote's Homeopathy Webinar Season 1, CME, and thank you all for joining us again. We welcome all homeopathic students, teachers, and doctors. My name is Dr. Rohit Gupta, author of the book and founder of Keynote's Homeopathy Enterprises. Keynote's Advanced and Complete Materia Medica is the most authentic and upgraded international edition of 122 years old Allen's Keynote with 15 new updates. It has 360 corrections of printing mistakes, completed 45 partially written symptoms, and added again 5 removed symptoms. All these messages are present in Allen's Keynote of all publications, which have been updated from 10 volumes of hearing guiding symptoms. It is the source book of Allen's Keynote. Added 2 new remedies, including 170 new symptoms from the extended work of Dr. S.C. Allen, which were published after his death. But all these updates have never been included in Allen's Keynote. No adulteration, only authentic content, not rearranged, and no change in the original form, following only the real format of Dr. S.C. Allen. So I tried my best to update first time this book of a great stalwart for the betterment of homeopathy. Now today's agenda: introduction of speaker, lecture, then questions and answers. In today's webinar, I will be privileged to introduce our speaker of the day, and today we have a renowned homeopathic teacher and physician from Hyderabad, Telangana. It's high time there, so should I introduce Professor Dr. S. Praveen Kumar, sir. He is BHMS, MBS, MD, PhD. He got Dr. APJ Abdul Kalam's Health and Medical Excellence Award in 2022. Ex-Principal and HOD, Department of Medicine, GSPS Government Homeopathic Medical College, Hyderabad. Trustee and Secretary of Global Homeopathy Foundation. Associate Editor, National Journal of Homeopathy. Telangana Government First Best Teacher Award winner for 2017. Dr. B.K. Bose Memorial National Best Teacher Award winner for the year 2005. Dr. Mahen Singh Memorial National Best Teacher Award for 2014. PG Guide and Examiner for many universities in India. PG Guide, Hanuman Homeo College, London. Associate Editor, National Journal of Homeopathy. Researcher of homeopathic medicine through in vitro studies for HIV or AIDS in collaboration with Indian Institute of Chemical Technology, Hyderabad. Now, sir is going to take this webinar on the topic clinical utility of Sarcodes. I would request everyone to please write their questions during the session in the chat window. So we will discuss them at the end of the session. Now I request sir to take this session ahead, and I hand over this session to sir. Professor Dr. S. Praveen Kumar is over to you.
Good evening, dear friends. Thank you very much, Dr. Rohit, for giving me this opportunity to talk to many of my friends. In fact, Dr. Rohit met me long ago and he gave me the first edition of his keynotes. And to be frank with you, I was a little skeptical. Even I also worked along with other stalwarts and we were preparing the keynotes, Allen's keynotes at CCRH. It was published also. Not that I made and others cannot make, I didn't think that way, but when I looked at him, he was too young and I thought, did he read the Allen's keynotes completely? Why is he writing again? But when I went through, he requested, he said, please go through and get back to me. When I went through, I found it quite interesting to read it. There were quite a number of things, like most of you, as I I was the head of the Department of Medicine, most of you would have read Davidson's textbook of medicine. There's so many boxes with red ink, so that some important points of that particular disease are highlighted. Like a take-home message. When you read the whole drug, and these are the most important things, some clinical indications, some things. So this pattern I have seen in his book and I felt very happy, right? Most of us are very much attached to Allen's keynotes because it is like, as my teacher used to tell, Bhagavad Gita of homeopathy, where every word is very valid, very important. And as he claimed, he did not remove anything which is there in Allen's keynotes. In fact, he highlighted some of them. I felt very happy. And he told me he's sending me the second advanced edition. But fortunately or unfortunately, I received few hours ago. I went through some of the important things there. In this book, I liked one thing. It's my prime duty to talk about the book which is hosting this webinar. This book I liked the column of relationship of remedies as is given in Bodic Materia Medica. And it is easier to see these instead of searching the keynotes and reading that last paragraph of relations. Then the other thing, like he has given this first action, primary action and secondary action, or first prescription and secondary prescription. I have to go through this completely. I have seen the salient features and I was liking them. And I was just asking him, where is this drug? You have given the number of Corallium rubrum. You have given the number of cinnabaris. Where are they? So they are there in the book. I was just inquiring them because I didn't have much time. But I'm very sure this edition will go a long way in helping the fraternity to go through the Allen's keynotes once again. And he claimed in one of the conferences where I met him, he said, it is not the replacement for the original Allen's keynotes, but it is only just an advanced one where people would love to see this as a last part. You can see it or you can refer it. You can just refer, like for example, you have got Robin Murphy's repertory, wherein reference would be easier. So likewise, he has so many greater aspects in this. And I assure you, Dr. Rohit, I would go through the book and get back to you completely. And I wish all the listeners here and the participants and all the people in the fraternity would definitely see, read, and then get back to him. He's very humble in saying, like, you get back to me if there are any problems, any defects. He is human, after all. So we can definitely do it, and he can come out with third edition as well. Right. Now, today we will talk about Sarcodes. In his book also, like Allen's keynotes, there are few Sarcodes like lac caninum, lac defloritum, likewise. So the utility of Sarcodes in our clinical practice. This is a very important aspect, very important aspect. Different things, the sources of Materia Medica. One, no source. Two, Sarcodes. We know no source are prepared from the diseased products or diseased secretions. Just switch off. And Sarcodes are from the healthy products. But are they really essential? Are they really useful only as just a supplement? When do we use them? It's a very huge topic. There are quite a number of books, like one of my good friends and a very learned man, Dr. Chaturbhuja Nayak, also wrote a beautiful book on sarcodes. Now we will see one case here. Man aged 60 years came to the clinic with an ultrasonogram report. You can just definitely see his face having a lot of anxiety, which is very common. Many people do have anxiety when they have a sickness. So please bear with me for a second. This phone is bothering me much. Right. And he was my regular patient. All his family members are my patients. This is what it happens with any homeopathic doctor. When one person comes to us, his whole family gets attached to us. He has been treated for chronic amoebiasis, being a regional manager for McDowell's company. And he's a great follower. He never took any other medicines except the homeopathic medicines. Once it so happened, he was to be admitted to ICU with serious problem, but he refused. Then I had to interfere and convince him, and then he got admitted, and he took allopathic treatment as well. So much of conviction in homeopathy. So he came with this because his cardiologist on a routine basis advised him to go for investigations. And the routine investigation showed 9 mm gallbladder stone. He was referred to surgical gastroenterologist, obviously in a corporate hospital, and he advised this patient to undergo cholecystectomy. He was very nervous, anxious. He was apprehensive as well. Now he's a nux vomica patient to a greater extent. His amoebiasis was almost completely cured with the help of a nux vomica. Now I was in a dilemma whether to give nux vomica or, as he did not have any great symptoms, because it was an accidental discovery of gallstones. What do we do? What medicine should be given, as there is not much of totality? So I have given cholesterol 6x. 1 tablet 3 times a day for 3 weeks. And we all know cholesterol is a sarcode. And one of the beautiful remedies for gallstones, Feltari, cholesterol, are beautiful remedies for gallstones. We also have in our homeopathic Medica, Berberis vulgaris, Nux vomica, or Lycopodium, or acid binge, China, Swan, Calcutta, many drugs. So after 3 weeks of period, I asked him to undergo ultrasonogram. He was in fact pestering me. I said, okay, take it. And when the USG was taken, the sonologist got shock of his life because he was the same man who took 3 weeks back. And he asked another sonologist to check it. He also did the same thing. Like here we can say 9 mm gallbladder colic, calculus, fatty liver, left renal cortical cyst. Now 29 August, this was taken on 8th August, and this is 29th August. No calculus, but fatty liver and renal cyst, they were still there. So he was very, very happy out of the, like, he had that type of happiness contention. That was one case which tells us that a sarcode is a very deep acting remedy. It's not just a supplement. It is not just a replacement. It can go deeper into the constitution and correct the dyscrasia if it is rightly selected. So we'll see one more case here. A 45-year-old man was diagnosed with type 2 diabetes, accelerated hypertension, We know very well accelerated hypertension, like a gentleman who has a base blood pressure, which above that it is so high with some target organ damage. Here, sodium was low and renal failure was also there. Complained of frequent vomitings, shortness of breath, pain epigastrium, giddiness, loss of appetite, oliguria, and BP was reading 210 by 120 mm of Hg. Blood urea 94, creatinine 2.8, potassium 4.6, sodium 100. It should be above 135. So this gentleman I have given, because he was tried in the hospital and they said, it will come down slowly, take these medicines. They have discharged from that corporate hospital. After keeping him for 15 days, the BP was not responding well. They sent him home. They said, no serious problem. You come down for dialysis if needed. Because it was only 2.8, they didn't want to do it. So I have given Naxvamica, I have given Punarnava, I have given Cupramars in few days period. Here I failed. I have given, depending on his kidney functioning, his other conditions, everything. But suddenly it stuck to my mind. They are not controlling his BP. And in fact, his main worry is BP now. And we all know very well, in renal failure patient, the clinical parameter by which you can assess whether we are on a right track or a wrong track is the BP reading. Now it is not responding. So obviously, the 3 drugs which I have selected were not correct. I have to change, review. Before that, I thought I'll give adrenaline. If you read adrenaline, which is a sarcode, there is a clear description of accelerated hypertension, uncontrolled. Within 2 days, the BP came down to 140 by 90. Later, of course, I have taken the whole case again, reviewed, then started his constitutional treatment. Naxvamica was not the first drug of choice, not the correct drug. I failed in selecting the right drug, but later I corrected myself. His drug was natrum muriaticum. I put him on natrum mur, and he responded slowly and steadily. It was my mistake, I do agree. Initial 3 drugs were wrong. But here the most important aspect, which we have to understand, is like adrenaline helped him to control his BP within 2 days, and he was very much satisfied. So this was one case. Then another third case, 7-year-old boy complaining of loss of appetite, weakness, facial puffiness, abdominal swelling, limb swelling, oliguria. Now if you see lab, 9 grams HB, cholesterol 542 milligrams per percent for a boy of 7 years. You can make a diagnosis very easily. Sodium is also low, 121. 24 hours urine volume was less, 1000 ml. But urine proteins, 688 milligrams. It was proteins in the serum, 2.5 milligrams, less. He was diagnosed to have nephrotic syndrome. So in this patient, the well-selected remedies, including no source, could not give relief. In fact, our failures teach us the lessons. Insulin 30, daily 1 dose for 1 week. I have given him afternoon, night, SL, daily 1 dose, morning, insulin 30, and after a week, it reduced the suffering to a greater extent. He is still under treatment, arsenic alum, I think maybe on 0 by 25 or so. So this is what one of the indications of sarcodes. We'll see that. When do we prescribe? How do we prescribe a sarcode? Another case, a 38-year-old male, diabetic, not controlled with oral hypoglycemic agents. Mixed 30 and 30 units, yet blood sugar level was very high. He used homeopathic medicines elsewhere with my sir, somewhere else, and it did not control. Him also I have given insulin 30. Once in 3 days, brought down the sugar level in 1 week's time. It came down, and then I started my treatment later, which helped. We have tapered off the human mixture, and even the OHA was removed, oral hypoglycemic agents. Now his blood sugar is under control. He is on only homeopathic medicine. Here I should tell you, I'm not giving him insulin now. I keep it as a reserve. If the sugar goes up, let me see if there is a need. Otherwise, he is on the regular medication. Now, what is another case? 53-year-old lady, palpitation, anxiety, nervousness, easy fatigability, sweating, increased appetite, feeling lonely, it does not want to talk to others. Second son committed suicide 6 months back. T3 normal, T4 normal, TSH 0.3, very low. T4 is also more. Ignitia and natremor in different potencies could only give relief of symptoms. But thyroid parameters were corrected by thyroidinum in 200 and 1M later in infrequent doses. Then again shifted back to natremor, put an end to the whole problem. The lady became all right. I don't need to treat her, I felt, and stopped the treatment. There are few examples. These are the few examples of utility of Sarcodes in our clinical practice. We've been using them extensively. Many of you, the practitioners of homeopathy, would be using many Sarcodes. Some of the Sarcodes you may not be aware, like you would have given lactaninum as a constitutional remedy. You would have given lactofluoritum for a child suffering with severe constipation. So likewise, you would have given thyroidinum to a patient who is suffering with hypothyroidism. You may not be aware of it. Like you would have given Jaconis, mother tincture, to a girl who is suffering with PCOD. It puts back the girl's menses on the tracks. So these are all different types of Sarcodes which we use in our practice, maybe knowingly or unknowingly, or referring to some of these things. So what is the meaning of Sarcodes? Fleshy means it is a protoplasm of animals. So it should be distinguished from vegetable protoplasm. It's an animal kingdom remedy. That's what somebody was telling. Sarcodes and mesodes mainly belong to animal kingdom. Mainly, because they are extractions, either from the healthy things or from the diseased things. But yet, they are separated into a different classes in the classification, depending on the source of Medica, source of medicines, because their action, their preparation is little different. So they are prepared from, Sarcodes are prepared from healthy endocrine or endocrine ductless gland secretions of living human organisms and lower animals. Other organs or other tissues are also being used. Most of the times, the secretions are hormones. And Sarcodes, in fact, contain the basic information of the biological structure of an organ, because it is carrying it. For example, you take testis extract. So it is carrying the information, the structural information of the testis. So if you energetically resonate that, then it supports that optimal organ function, and it also removes the toxins from the body. David Lowenfeld mentioned. Now, if you see the journey, in fact, I should also acknowledge my friend Dr. Ajit Kulkarni. He helped a lot in really many homeopathic doctors to understand sarcodes in a better way. Now, these sarcodes, they travel from physiology because they are from the physiological structures. And they travel from physiology to pathology, from a source of healthy secretions, normal homeostasis, and then they will be applied to a pathological condition. So this is like functional problem going to structural problem as envisaged by Hahnemann. So they are prepared from secretions of healthy organism like cholesterol or insulin or thyroidinum likewise. J.H. Clark mentions very clearly, I have found the term sarcodes useful for designating the remedies prepared from healthy animal tissues and organs. So he mentioned there. And he also says one important thing here. They are prepared from healthy animal tissues and secretions. But the preparations of poisonous animals like Homerus or Sanguisuga. Sanguisuga is prepared from leech. So they are not included under sarcodes because they are poisonous. There are some toxins. And already you are taking a toxin, and how can you call it as an healthy secretion? It is not a healthy secretion. So they are exempted. Clark was very wise in distinguishing between the preparation of poisonous animal and a normal one. So he has given some examples like adrenaline, arenaria, or calcaria, ovatosta like colostrum, all these drugs. Now the usage of sarcodes and nosodes, that is different from any other system of medicine. Though they come very closer to us. For example, if you see the hormonal therapies, they come closer to sarcode therapy. If you see the vaccine therapy, you come nearer to nosode therapy. There are quite a lot of differences, but they come nearer to us with little similarity. Now, if you see the medicines, according to the sources pertaining to sarcodes, the medicines which are prepared from whole endocrine glands like thyroidinum, pituitary, or from healthy secretions like adrenaline or cortisone or ACTH or insulin or pepsin. And the third variety sarcodes are from extracts like testicular extract, orchitinum, florinum, pancreatinum, corpus luteum. These are the sources. Or the fourth other different varieties like colostrinum, peltodi, all mammary glands, parotidinum, and all that. There are so many drugs, like more than 131 drugs are there in Materia Medicas, different Materia Medicas, which are on the grounds of sarcodes preparation. Many drugs. You can see the list of these many drugs. But some of the nosodes preparation is little questionable, like ambrosia. I was referring to Rohit Gupta's latest book immediately because I was preparing this. So I said immediately, I referred where he mentioned it as morbid secretion of sperm whale. Then it becomes nosode, morbid. Anything morbid is a nosode. But otherwise, if it is not a morbid secretion, then it ties up with nosode or sarcode. Then malaria also prepared from marsh or bacteria and fungus. If you take them as a living being, then it can become a sarcode. But usually they are pathogenic, so they are not put under sarcodes. Now, when do we use sarcodes? What are the indications? One is as a complementary, like as an acute of chronic letter mode, in an acute case of urticaria. Or in quite a number of cases in my clinical practice, thyroidinum I have used in cases of psoriasis. It's very, very useful. If no drug is active, or if you are doubtful of a drug to be selected, or if you are seeing that lot of increased vesicular maculopapular eruptions, the patient is suffering so much, start with thyroidinum. It comes to a stage where you can now give a homeopathic remedy in a dynamized potency. Though, of course, thyroidinum 6X is also dynamized, but a little higher potency. Or a sarcode can be used as an organ stimulator, like pituitary gland as an intercurrent remedy in pituitary microadenoma. I have given, in fact, there is one patient to whom I have given, his developmental problem is there. He is now 23 years. His testicles are not developed properly. His pituitary hormones are weak. So he is put on pituitary 6X. Then some of the clinical conditions where the organ loses its very functional or structural condition, where its utility is less. Like in the case of cirrhosis of liver. What happens in cirrhosis of liver? Liver becomes shrunken. So its structural area is less, its functional capacity is less. There you can think of the remedy. Or spinal cord neoplasms, cerebellar degeneration. So you can give such like heparsis or medulla spinalis or cerebellum. Those extractions from these respective tissues can be used. Or clinical conditions where hyperfunctioning of organs, like adrenal hyperfunction in Cushing syndrome, or in that adrenal, that's actually adrenal. It can be given in overgrowth with growth hormone like acromegaly or obesity. Some of these drugs, sarcodes, can be used in those conditions where you're dealing with one particular entity and you're not able to select a constitutional remedy. I'm not saying that a sarcode will replace a constitutional treatment. A sarcode will replace an anti-miasmatic treatment. Never, never, ever. But it will help as these different conditions I am telling you, they will help you in treating different types of cases at different times. Now, when a single organ is the basic general condition of serious disorder, now you can think of that. Myocardial ischemia has developed CCF, and you can't prescribe a constitutional remedy in this patient who is having a lot of serious problems. Then myocardium in lower potency, that extract can be given. Or in cases of paucity of symptoms, their functional or structural type, where it is difficult to find a constitutional remedy. Naturally, you can start with. If the pathology is advanced, you can't prescribe a nosol. You can prescribe a sarcode. Because we usually prescribe sarcodes in decimal potencies. Usually, thyroidinum I do prescribe in 200, 1 10 m, depending on that condition. Or where functional or structural type where it is difficult to find, and that is repeated. A case of the pathological museum where multiple vital organs are affected. What to do then? Then you select according to the organs affected, one sarcode after the other, so that in a sequential manner, then slowly and steadily, he will regain his strength with regards to his different affected organs, and he will come to terms where he can throw up some characteristic features, and you will be able to select the right remedy at that stage. Or when the disease shows its play in some organs that are bound together by a system, the combination of diabetes, hypothyroidism, PCOD, where the endocrinological system is affected, you can prescribe a sarcode. Or exorbitant investigative reports in a functional or structural case, where severe high cholesterol, high bilirubin, high creatinine, or blood urea. In one condition we have given, where high bilirubin was there. So we have given, insulin was also given in this high bilirubin case. Status quo condition in a pathological case, where nothing is moving. What to do? You have prescribed the best selected remedy, all different combinations. Now, just think quietly, what is the major organ which has been affected? What should we do? Now, for example, the liver is affected. Okay, start with the liver extract. Liver, 6x, slowly, improvising. So then you can go on. Or on the basis of past and family history of certain clinical conditions that might have a dynamic effect on the constitution, like history of hypo or hyperthyroidism, family history or during pregnancy where one can prescribe thyroidinum. You are referring to the major important endocrine organ, thyroid, causing one after the other sequential constitutional dyscrasia. Then hit at the root. Prescribe thyroidinum. Slowly and steadily it peels away. Hahnemann mentioned very clearly in Organon. Most of the times, we will not be able to select the right simillimum exactly. So you may be needed to prescribe partially similar remedies. So this is one where you are partially matching with only organ affected and slowly and steadily improvising the condition of the patient. Then preponderance of pathology with low susceptibility. It is always preferable to prescribe a sarcode. The case of advanced pathology where the vitality is very in its lowest step and you can't prescribe a constitutional remedy. So you should prescribe a sarcode instead of no salt. Then clinical confirmation, where a sarcode like pituitary in case of delayed puberty and underdeveloped breasts. You can think of pituitary. Though of course underdeveloped breast, thyroidinum is one of the best remedies. Saval cerulata, thyroidinum, they are beautiful remedies. Then for the sake of detoxification, you have to do the detox type of condition where you see a lot of toxins are accumulated, the patient is in very low vitality, then you can think of sarcode. These are all the different types of experiences of stalwarts where different types of indications for sarcodes. Each emotion has a related organ or organs. There is one concept as I was reading through a book. Every organ has its secret meaning. Each sarcode remedy carries a language, a message, a code in it, as it has been extracted from a particular living healthy organ or a normal secretion. So it carries that code, and that would be useful. Like for example, in breast, it has a symbolic language of mothering, nurturing, and nourishment. So you can, if an individual has a problem at these levels, you can think of breast extract or colon. What is its symbolic language? Like fear of letting go and holding on to the past. If a person has got this type of core mentality, then you can give a sarcode like colon. Are we prescribing basing on the core of the constitution? To start with, probably colon in lower potencies may not be able to cure this person with a severe pathology, but it will pave way for a selection of a correct remedy. Pituitary gland, again, it is the control, like a central government, Modi ji. So you can think of that where the control, central control is missing in that individual. Now let us see some of the drugs here as a Materia Medica. From adrenal gland, adrenalinum, accelerated hypertension, I have shown the case, Addison's disease. I am giving clinical indications, not giving you the Materia Medica. Addison's disease, adrenal neuralgia, bronzed skin in one patient for pigmentary disorder on the face, below the nape of the neck and upper chest and below the arms. Brownish type of pigmentation. I have given adrenaline for quite some time. There was a lot of improvement. Though, of course, I followed it up with sepia later. Hematuria, hyperemia, palpitation, tachycardia. Then Aranearum tela. It is from the cobweb of black spider. And for sleeplessness, we all know there are quite a number of drugs in our Materia Medica for sleeplessness. Like we prescribe Califas if there are no other indications, or we prescribe Passiflora. If the patient has a serious problem and sleeplessness for ages, like I was shown to a patient. In fact, a patient was brought to me. A boy of 13 years did not sleep for 7 days, did not even wink. I have given carcinosin. Though the boy was not able to tell anything, probably some pressure, some disciplinary problem. Parents were good, but maybe from the teachers. So carcinosin, when the moment I have given in the evening in the clinic, carcinosin 1M, the father called me and told he has not eaten dinner. He slept off and he is just snoring. I told him, don't wake him up. Let him sleep. He woke up at 11 a.m. next day morning. So carcinosin is another remedy. Such a type of prescriptions, if they are not helping in a patient, and you don't have any other indications or characteristic features, then you may also think this remedies are good for sleeplessness. Then this Ovatosta, I prescribe quite often to patients, ladies who suffer with leukorrhea. You have different remedies with different expressions in our textbook of Materia, ranging from syphilinum, calcarea, calophyllum, sepia, pulsatilla, so on and so forth. We prescribe this remedy when we are not able to select a right remedy, or when there is a paucity of symptoms, then this is the best remedy for leukorrhea. I prescribe for leukorrhea. Then castor equi, from the horse thumbnail, one of the best remedies for coccygodynia. We have remedies like calicar, esculus hip, hypericum, arnica, ruta, bryonia, such remedies which are very useful for coccygodynia. But don't ever forget castor equi. It's very, very useful. Though it can be used in epilepsy, affections of nails, nipples cracked. In one case in our hospital, when I was working in the college, I have prescribed castor equi for a lady who was admitted with some other problem, but has nipples cracked. But I did not find much change in that. Probably it wouldn't have been indicated there. Then the most important, cholesterol. I already mentioned gallstones, gallstone colic, cancer liver. Even in a cancer liver patient, we can think of cholesterol. Then cholesterol is the milk first secreted after childbirth. In cases of especially children who have diarrhea, unexplained type of diarrhea, then you can think of cholesterol, which is useful. Conchulinum, like for osteitis and pyemia. If there are like osteitis type of conditions where the bones are going inflammatory, then you can think of this remedy. Then cortisone. In fact, I felt very bad when Dr. S.P.S. Bakshi was telling me that he was arrested for a sin which he has not committed, for a drug which was caught in his Calcutta clinic, and which was reading as cortisone, and that was his major criminal act, because of which he was arrested, according to Dr. S.P.S. Bakshi when I went to his college. Anyway, cortisone is one of the best remedies. I do prescribe in quite a number of cases where the patients come to me. And in fact, nowadays, I am prescribing cortisone to the patients who are developing diabetes after being given cortisone for their COVID condition. If they have developed cortisone-induced diabetes, this is one of the best remedies to start with for hypoadrenalism as well. In Feltari, I keep giving to quite a lot of cases of polylithiasis. And then Elixitosta. It is toasted snail for hemoptysis, for phthisis. I have not used it. The other drug is Hipomains for one wrist paralysis patient who was having this. Actually, I tell you, this wrist paralysis patient, he was admitted to a very big government hospital and he was operated upon for kidney stone. And this man developed right wrist paralysis. After he recovered from anesthesia, he saw right wrist paralysis. And in no way there is connection. Absolutely no way. Maybe because of some compression, maybe because of some compression here while the patient was put on the operation table. So every drug was tried according to them. After 2 days, I was called to see in that hospital. I went. I gave, in fact, plumbum metallicum. This patient recovered. And after 6 months, he came with same problem. For this patient, I have given this remedy. Because he did not have any symptom, nor any history, nor any compression. He just developed. I have given plumbum metallicum 1M. But at that time, I was teaching Medica in our college for PGs. And I thought I would do it. He came to my OP there, and in front of my PGs, I have prescribed this drug, and I told them, get it. And he had to go and get that remedy because it was not available in our pharmacy. Humerus from the digestive fluid of live lobster for dyspepsia, sore throat, headache, common together after taking milk or getting aggravated after milk. If a patient develops headache with sore throat and dyspepsia, all three together, you can think of some remedies like phosphorus, some remedies like carbovage. This can also be a remedy. Amelioration motion. Then, this is one of the most favorite drugs in Sarcodes, insulin. If any diabetic patient has shown resistance to artificial insulin, if the insulin is prescribed, yet the sugar level is not coming down. If you don't select the right remedy, or you are not able to select only based on this, if you want to give insulin, it is available in 6X, 6C, 30. I keep giving 30 potency commonly, and it is one of the best liver remedies. And it can also be given for chronic functional derangement. If a person is having some functional derangement, all the organs, pathology is not there, but functional derangement is there, then you can think of insulin. Even an enlargement of some liver or some problem, then you can think of this particular insulin. Insulin is also one of the best remedies for liver conditions. We usually think insulin for pancreas. It can also be for this remedy. And insulin, if you see, as I was telling, for malignant liver, like in one liver cancer condition, without jaundice, which is very, very difficult to get it, you can think of insulin. In low potency, 30 or 6, then you can give. And slowly and steadily, it would improve. The patient will improve. And there can be a palliation. If the patient, HCC is a very common condition, and in those conditions, you can think of insulin. I've given in quite a lot of things. Then if you see lac caninum, many symptoms. It is one of the constitutional remedies. And like, for example, most of the patients who complain of dreams of snakes, one of the best remedies. Or you have got diphtheria, the best remedy. Severe dysphoria, best remedy. Leukorrhea, best remedy. Or mind, hard in the air, as if the mind is hard in the air. Lac caninum is one of the best remedies. For varicose vein, beautiful remedy. So likewise, you have got many conditions. We always think of Tusa for ranula. You can think of lac caninum also, if you fail with Tusa. The lac defloratum, obstinate obstipation, where there is no movement at all of the bowels. Suppressed menses after milk. If someone has drunk milk and menses should have appeared on that day and it did not appear. Why, somebody might question. Why milk on that day? They drink every day. Most of the ladies don't drink. They were forced to drink on that day, menses stop. Migraine and to increase milk in the lactating mother. It is not the laccaninum. Laccaninum and asafoetida are to stop the milk. If the mother were to wean off from giving milk to the child, then you can think of either laccaninum or asafoetida. But to increase the milk, lac defloratum, one of the best. Then, of course, lac felinum from cat's milk. Ciliary neuralgia, best remedy, lac felinum. Dysmenorrhea, keratitis, headache, inflammation of mouth, stomatitis, styes. Then, from cow's milk, lac vaccinum, intolerant to milk, causing headache, biliousness, flatulence, nausea of pregnancy with desire for food, aggravation milk. In cod liver oil, which is being abused many a time for many such substitutions, cod liver oil is being used. If that is extracted and made into a homeopathic remedy like 6X or so, then you can think of Addison's disease, amenorrhea, cold abscess. For dwarfishness, this is one of the best remedies. Headache, liver diseases, and tuberculosis, rheumatism, ringworm, and some of the vision affections also. And cod liver oil, along with Oleum jacoris, the best remedy for unwanted hair growth. Most of the young girls do suffer. If they have PCOD, they will have unwanted hair growth. Very severe unwanted hair growth. You can think of Oleum jacoris if they have menstrual irregularities. If they don't have menstrual irregularities or they have only thyroid dysfunction, then you can think of cod liver oil. That's how you can differentiate them. Then euphorium. This is like our teacher, like he was not teacher, but he was our principal, Dr. G.K. Narasimha, used to prescribe this euphorium quite a lot in severe acne conditions or menopausal conditions, flushings and all that. He used to prescribe. And especially in those ladies who have undergone oophorectomy. The ovaries have been removed due to various reasons. And they develop a lot of symptoms. So elements from removal of ovaries, you can think of oophorectomy. Prurigo, itching without eruptions is prurigo. If there is itching, then you can think of euphorium. In fact, dolichos is a remedy which has got prurigo, itching without eruptions. Then testicular extract for climacteric sufferings of females. You can think of these tests. Or debility, senility, sexual weaknesses. Then you can think of, like, people will have erectile dysfunction or early ejaculation. You can prescribe it. You can't prescribe a constitutional remedy quite often or continuously. You would have given a dose and the fellow wants what to give. Then, if needed, you can prescribe this Sarcode where it will give extra nourishment and it acts like a tonic and the patient will improve faster. Then pituitarinum for easy parturition, for cerebral hemorrhage, growth abnormalities, and then pulmovulpis, like fox lung. For a severe asthma, I prescribe at least in half a dozen cases, pulmovulpis. It is available. Then Spingurus, as I was mentioning, this is one of the poisonous animals, Spingurus, in fact, porcupine, but it has also been, like, from its prickles. It has been extracted from a healthy finger. The prickles are being taken because there is nothing like poisonous substance there. So it can be called as a sarcode. From beard, in one gentleman, I tell you, his beard was having map type of appearance, not alopecia areata, but map type where he was losing a lot of hair here and there and all that. So I have given this fingers. For jaw joint pains, which we call it as temporomandibular joint problems. Commonest cause for TMJ problems is stress. So you have to address that stress, talk to them, counsel them, they might overcome that TMJ problem. Otherwise, this is also one of the drugs. Stammering is also there. Then thyroidinum, too many clinical indications. In fact, for hair fall, I prescribe. For young ladies who want to increase their breast size, I prescribe thyroidinum. Not only for thyroid dysfunction. If the person wants to take thyroidinum or wants to get treatment for thyroid problem, they are on L-Troxin 100. In one case, L-Troxin 150 was given, asked by the endocrinologist to dissolve it in water and take. Because his TSH was never falling below 100, in spite of giving this. So we have started with thyroidinum 6x. I started with one morning, one night, and slowly and steadily. Now it is absolutely all right. So that is not like its usefulness. It goes a little beyond that particular substitution because it is potentized. 6x is a potentized one. In cases of abscesses, in case of psoriasis, I keep giving quite a lot of cases. Of course, obesity I have not given to anybody. Then urinum, extracted from or prepared from urine, acne, boils, dropsy, ophthalmia, scurvy. So to conclude, we know that there are a lot of information about sarcodes at various places. There's so much utility of sarcodes also. When I'm reading these Medica of these drugs, or when I've shown those 5 cases, we have thought it's very useful, each sarcode. But still, it is like a story untold. Many people are not aware of it. Many people don't use it. More and more studies should be done by homeopathic researchers, especially I urge upon like people in PG colleges to entrust at least one student from each batch to study one sarcode and then do it. So that would be very useful. So before I conclude, I thank Dr. Rohit Gupta and all his team members and all you patient listeners for having given me this opportunity, and I hope you have got some information about sarcodes. It is not ultimate. There is a lot more information available in each and every textbook. But I really congratulate Dr. Rohit for his stupendous work on these keynotes. I congratulate him once again and thank you very much. If you have any doubts, you can ask.
Thank you so much, sir, for an amazing webinar and great teaching on this topic, sir. Sir, shall we start the question and answer session?
Huh? I couldn't get you.
Sir, shall we start the question and answer session?
Yeah.
Okay, sir. Sir, we have got, sir, many appreciation messages.
That's okay. That's not a big issue. I'm saying Dr. G. Naumya. Naumya is our friend Naumya. Is he the same man? Okay, anyway, right. Okay,
sir.
Any questions?
We have a yes, sir,
I Naumya.
Questions. Sir,
Naumya, are you in the office now? Okay, anyway. There are no questions?
Sir, we have lots of questions, sir.
Okay.
Sir, first question.
You don't ask me because if you ask me, I don't know. Well, you know more about Materia. Okay, right. First question.
Sir, in Parkinsonism cases, which Sarcode can be thought of, sir?
In
Parkinsonism.
Parkinson's?
Yes, sir.
In Parkinson, in fact, I tell you actually, the best medicine I have used, it is not the Sarcode. It is the Bacopa muniri, which helps in 1x potency. Brahmi.
Bromine, sir.
Brahmi, Bacopa muniri, 1x, very, very useful in Parkinson's. There are many drugs, constitutional remedies. Depending on that, you have to select. But as it has been asked to contain like, what is this? Sir, I have one patient of age 18 still. Read that question. Anyway, so Bacopa is one of the best remedies. Okay. Read,
Okay, sir.
Dr. Rohit.
Yes, sir. Sir, I am reading, sir, from starting, sir.
Bacopa muniri, Parkinson's remedy. Bacopa muniri, you can call it as Brahmi. Brahmi works.
Okay, sir. Sir, which books should we refer to study about Sarcodes?
I was referring to Dr. Chaturvesh Nayak. His book is beautiful.
Okay, sir. How much time repeat insulinum?
Repeat depends. If I have given 30, I have given one dose. Repeat necessity. Following Sarcodes. Jack. Yeah.
Okay, sir.
You're asking some question. I missed that.
In vision affection, which remedy can be used in Sarcodes?
Sarcodes, which remedy I have not used any remedy in vision effects. I don't remember using any Sarcodes. I have used Ruta. I have used Natramore commonly.
Okay.
Is it Brahmi? Yeah, it is Brahmi. Right.
Okay.
Yeah, Bacopa. Correct.
Sir, adrenaline potency in
Adrenaline?
Sir, how can we use adrenaline in which potency?
Yeah, usually I use adrenaline 6C commonly for accelerated hypertension. And I keep giving it depending on the intensity. Like in that case which I have shown, 210 by 140 or something, it was there. So in that case, I have given early.
Sir, we have one more question, sir. Creatinine with urea have increased. Which medicine we can use in sarcoid?
Creatinine?
With urea have been increased in the case. So which medicine?
I tell you the best drugs for chronic renal failure with urea creatinine high. You can think of Punarnava. There should be hypertension along with it. Punarnava. Borrelia diffusa is the description of that name in textbook of Medica. Punarnava can be used in mother tincture or Solidago where there is no edema, or Juniperus that can also be used, or Cupramars. I usually prescribe Cupramars 0/1, 0/3, 0/6. Apart from the remedies like Nux vomica, arsenicol, all the other rara metallicum, lycopodium, those are all the remedies which are used depending on the expression of symptoms. But these are specific. They can be used very better. They will be very useful.
Okay, sir. Sir, for hoarseness of voice, suggest any medicine.
1 minute. Punarnava, Solidago, Juniperus. 3 are different remedies. Some spelling mistakes, please verify. Cholesterol and calculate in prescription of God. Actually, cholesterol is the best one which will be very useful instead of taking calculate and it is being prepared. Calculate is a pathological substance. So cholesterol is a physiological substance. That becomes sarcode. That can be used. Feltari or cholesterol best for gallstones. Yeah, you were asking Dr. Rohit. Another question.
Sir, for Down syndrome, which Sarcode we can use?
Down syndrome, usually you can use pituitary extract. Over.
Sir,
Spelling of book mentioned, please. Book. That's what, like Sarcodes by Dr. Chetur Bhujnayak. Sarcodes by Dr. Chetur Bhujnayak. He was CCRH Director General. He was Director of Homeopathy University, Jaipur. He was in Bid College also. Yeah, Dr. Chetur Bhujnayak, right?
Sir, Dr. Guneet Pal asking a question, sir. I have one patient of age 18. Still now menses did not appear. All reports are normal. What to do, sir?
Guneet was our student. Guneet is asking. Good boy. Very good. Now, if 18-year-old girl does not get menses, first investigate thoroughly. Is there any problem? My Mrs. Dr. Aruna was seeing a case where 18-year-old girl did not have menses, and when all the investigations were done earlier, gynecologists have seen there was no uterus, there were no ovaries. So it is mullerian agencies. It needs a deep constitutional antimiasmatic treatment. Sarcodes may not help at that level. You need to go deep into the constitution.
Sir, any Sarcode for hair falling?
Hair fall for you? In fact, oleum jacarus, and in fact, so many other remedies which are there. I don't remember, but best drugs for hair fall are nosodes like syphilinum, carcinosin, sorinum. Those are the best remedies.
Okay, sir. Sir, listener, sir, could not understand the name of medicine for Parkinsonism. Can you write, sir, in the
name of medicine for
Parkinsonism, sir? Can you write in the chat box, sir? Spelling they want.
That's what they have. One participant wrote also. Bapu Brahmi. They have written in the chat box. It is there.
Okay, sir.
They have written. Yeah, let's see.
Yes, sir. Yes.
Seema Pillai, thank you very much. Doing my job. Brahmi, correct. Most learned audience here you have. I should appreciate them. Thank you.
Sir, for carbuncle in non-diabetic after COVID vaccination, which medicine can we use?
For non-diabetic?
Carbuncle.
Carbuncle.
Yes, sir.
Yeah, carbuncle, non-diabetic, post-COVID.
Yes, sir. COVID vaccination, post-COVID vaccination.
Post-COVID vaccination. Carcinosin is the best remedy.
Okay, sir. Sir, in ear discharge and bad hearing, which medicine can be given?
In ear discharge and?
Bad hearing problem.
Bad hearing. Oh. CSOM, you can think of many drugs like Silesia, Pulsatilla, Heparsulf, Sorinum. Those are all the remedies which are indicated for ear discharges. Mercurius. Those are all the common remedies.
Yes, sir.
Carcinosin 1M is the best choice. Somebody gave question. Okay. It is becoming like my friend in NGH told, it is becoming like Viva. They are taking Viva of me. Hypothyroidism, thyroidnum 6X is the best remedy to start with if you don't get any constitutional remedy. Depending on TSH level.
Sir, we have one more question, sir. What potency would be preferable for carcinosin?
Carcinosin 1M I have answered.
Okay.
Urea can be given. Yes, for CRF patients, if the urea is high, and when the urea is high, creatinine is also high. They are all from the same purine metabolism.
Sir, a patient of hypothyroidism, 26-year girl.
Yeah, I answered that. Thyroidinum 6X.
Okay, sir.
Rupali, thank you. Okay. Suggest medicine for hoarseness of voice. Hoarseness, you have got calcarea, carbovage, phosphorus, heparsulf, Eucrium marum verum. Those are all the drugs which are useful for hoarseness of voice. Depending on the modality, morning modality different, evening modality different, painful hoarseness different, painless hoarseness different. What made that hoarseness? Like, for example, there is polyp on the vocal cord, a nodule. Then selenium or thuja could be best drugs. Likewise, Navjot Singh Sidhu is there. My, then, right?
Yes, sir. That's it, sir.
Thank you very much.
Thank you so much, sir.
Thank you.
Thank you to everyone who joined us today. Let's connect tomorrow at the same time, 8 o'clock, for the continuation of this webinar season 1.
Thank you.
With another speaker, Professor Dr. Amit Nayak. Thank you so much, sir. Thank you to everyone. Thank you.